I'm Dr. Gabriel. I go by Dr. G. I'm a general dentist practicing in Wiley, Texas. My practice name is Trusted Dental Care. So today I'm going to talk to you about implant dentistry. A lot of people would come to my practice and say, I want implants. So today I'm going to kind of share with you what we're looking for with implants, because there are many. Is the person might be missing single tooth, might be missing several teeth, ripping off their own existing teeth and by replacing with an implant is an option. So here is kind of a guideline on how we address implant dentistry. If you have your own natural teeth and they can be saved, saved meaning going through periodontal therapy and whatever is necessary. If the biology is there, the bone is there, if we can save your natural teeth, our primary choice would be to save your natural teeth and address the cosmetics and the function. So you might be thinking, just because you don't like the way your teeth look, you might be thinking it's for me time to do implants. That's not the answer. The answer in that case would be, if your teeth are in the good, the foundation is there, the bone is there, then we would cosmetically address your main concern. When is implant dentistry the right time to do it? Well, we look at it, we look at the biology, we look at the foundation, your bone, your overall health. And if we can't save, or if you don't have the biology to keep your teeth long term, as in 5 years, 10 years prognosis, then we can have a conversation to say, you know what, these teeth are not gonna stay there long term, so maybe it is time to talk about dentistry. So in that case, is it a single tooth? Is it multiple teeth? What can be done? Let's talk about implant dentistry. I have a person who might come and saying, I wear a denture right now and I hate it. Quite frankly, I have a lot of people that wear dentures and they're miserable. They hate it. I can see why. Imagine, this is an example of a denture. So you can see this person has no teeth. So you've got a piece of plastic and you think this piece of plastic will stay in the mouth? Good luck with that. So a lot of patients would come and say, I hate this denture, it pops out when I eat, it pops out when I'm speaking. So the best solution for this kind of patients would be going with implants, okay? Implants, when I say implants, for example, you've got few options here. So in this case, this is kind of an example. The term is called all-on-4. In some cases, you would hear the word all-on-4. It doesn't necessarily mean there are only 4 implants. The right terminology would actually be all-on-X. What that means is that they can be 4 implants, they can be 5 implants, they can be 6 implants. Quite frankly, the number of implants doesn't really matter. It's all part of the design and discuss about, what kind of bone does this person has, can we place, obviously, if we have 6 implants, it's gonna be more. If in any case, if one of the implants fails, we still have 5 to hold on to that denture. So don't get caught up with the all-on-4, but it really is all-on-X. What that means is you would place the implants, kind of so like this, and then you would have the prosthesis secured by screws in. The beauty about this is you don't have to take it in and out. It is going to be designed also cosmetically pleasing. It will be designed that fits into your face and looking at from cosmetics. And so everything is going to be cosmetically driven implant dentistry. That's the beauty of it. The other beauty of it is, if you look at your your denture, there's a whole palate covered with plastic, which also stops from tasting your food the right way. And imagine we have taste buds in our palate. Guess what? When you have a denture, you just cover the entire palate, which makes you can eat all you want, but you won't taste the food. So that's the benefit of having something like this would be, if you see it, the palate is cut out. And so we're only putting in the teeth where they should belong, and it is secured. You have no trouble, in most cases, if this is done correctly with the technology, very well designed, this can look like your natural teeth. Quite frankly, if it's done right, you can't even tell it is a denture or an implant. And that's kind of the beauty of it. The beauty of cosmetically driven implant dentistry is that you want to create natural looking teeth, but they're fake, but nobody knows. And that's the beauty of it. And so this would definitely be the best choice for someone who has no teeth. Obviously, if this is not financially possible, there are other options as well. You can still have implants supported, but removable. So in other words, it's not going to flap around. So here's the case, for example, this is kind of a lower denture with implants. So the beauty about this is that it's not going to be the first case that I showed, but it would clip. And so it would have something to clip onto the jaw, which means that the implants are kind of an anchor to clip it. Now, the advantage of this is, well, it's a little cheaper than the better choice, but it also is much better than your regular denture. So those are all when you're missing all of your teeth. But when you're also missing, a single tooth or a couple of teeth, for example, here you can see this person right here is missing a single front tooth. Guess what? You could do a bridge, or you can also do an implant. The beauty about the implant is you're not relying on those two adjacent teeth. You're literally securing this crown by having a single implant. And so that's the advantage. When a person is missing a couple of teeth like so, you can see a few teeth, you can also just do an implant bridge. And so the beauty about implants is you have so much option as far as you can go single tooth, you can go multiple teeth, you can go full arch, you can go all you want. It just, whatever fits into your budget, but this definitely is going to improve the quality of life. Trust me, I have patients that wear just regular dentures that are miserable, they hate it, they can't go on a date with it. And I have patients that have implant supported prostheses. They love it. Seriously, they can eat steak with it. They're not embarrassed. They love it. And so it just really is knowing where you want to spend your money. Do you want to have a quality of life and you can eat your steak, or do you want to put that damn denture and you're miserable and you can't speak with it, you can't deal with it? You make that choice. All right, again, this is Dr. G from Trusted Dental Care. This is information about implant. If you wanted to know if you're the right candidate, or if you wanted to get a consultation, you can give us a call at 214-702-0446. You're in good hands. We'll take care of you.